Studies have found that, of all mental disorders, schizophrenia carries the highest stigma burden. Schizophrenia tends to be associated with incompetency, with violence, and with dangerousness. Its sufferers are stereotyped as untrustworthy, unreliable, irrational, aggressive, unpredictable, unintelligent, frightening, out of control, and more besides. These damning representations leave schizophrenic people socially isolated, underemployed, hyperpathologized, and, crucially, ashamed. Two things need reiterating here. The first, that this stigma is not a merely superficial affair. Not only does recent research show that more than 40% of people with schizophrenia report suffering high levels of social stigma, but moreover that this stigma can be internalized, can come from within. This diagnosis comes, then, with negative attitudes, including internalized shame, at all levels, just as much personal and interpersonal as societal. Secondly, it bears emphasizing that the impact of stigma is significant and even decisive when it comes to the life chances, the opportunities for treatment, the medical and community care available to the people attached to this diagnosis. Because the stigma associated with schizophrenia is so powerful, sufferers will tend to put off seeking medical help. Because of the stigma, people will conceal their conditions or their diagnoses from acquaintances, friends, neighbors, and employers. In fact, mental health professionals report that patients request fictional diagnoses or neutral hospital stamps on sick notes, precisely to evade the dangers of their own diagnoses. Indeed, it's no coincidence that this stigma is often described as a second illness. Someone who suffers because of their symptoms suffers again, in addition, the effects of being recognized as a schizophrenic person.